The room went silent when she walked past his office. Dr. Mercer watched through the glass as the mid-level nurse adjusted an IV bag with a kind of mechanical precision that belonged in an OR, not a pediatric ward. Her scrubs hung 2 sizes too large, navy blue fabric swallowing her frame like she was trying to disappear into the hospital walls. He saw efficiency. Competence. The kind of calm that didn't bend under pressure. What he didn't see was the way her hands never trembled. What he didn't see was the scar tissue mapped across her shoulders like a roadmap of survival. What he didn't see was the call sign tattooed in block letters on her ribs, a name she hadn't answered to in 4 years, a life she wasn't supposed to have anymore. Laura Bennett had arrived at Seattle General in Raleigh on a Tuesday in March, her credentials immaculate, her interview brief. 23 years in nursing. No gaps. No explanations needed. The hiring manager barely glanced at her references before sliding the paperwork across the desk. She'd taken the job in pediatric neurology because it was quiet. Because the children didn't ask questions. Because no one here would recognize the woman who'd carried a 200-pound Marine 3 miles through Kandahar with a sucking chest wound and nothing but a field knife and gauze. That woman was supposed to be dead or deployed or living under a different name in a different state. Laura Bennett was supposed to be invisible. She touched the folded flag in her locker before every shift. It was small, no bigger than a greeting card, creased and worn from 4 years of her hands pressing it flat, running her thumb across the fabric in the dark. Nobody asked about it. The other nurses had stopped asking questions after the 3rd time she didn't answer. There was a story there, that much was obvious. Dead brother, probably. Killed in service. The kind of grief that made sense in a hospital where people died for reasons that had nothing to do with what you could have done differently. No one needed the full truth. The folded flag was enough. The pediatric neuro ward smelled like antiseptic and something else, the particular staleness of a place where families kept vigil, where the air got recycled and reused until it tasted like fear and hope mixed together. Fluorescent lights hummed overhead in a rhythm that reminded Laura of helicopter rotors if you weren't listening too carefully. She preferred not to listen too carefully. Room for 12 was her first stop, as it was every Tuesday and Thursday. The patient there, a 34-year-old veteran named Marcus with a forearm scarred from shrapnel and a call sign tattooed in letters that matched hers, was recovering from a surgery that had nothing to do with why she actually checked on him. He was stable. His vitals were solid. His pain management was adequate. The truth was she came because sometimes he looked at her with something flickering behind his eyes, something that suggested recognition, and she needed to know if her cover was still intact. Today Marcus was sleeping. Morphine drip running at 2 milliliters per hour. His chest rose and fell with the mechanical rhythm of a man whose body had learned to survive things most people couldn't imagine. Laura adjusted his full line without waking him, her movements economical, precise. The kind of precision that came from doing this under fire, from the muscle memory of keeping people alive when the only light came from tracers and the only sound was screaming. She didn't linger. Lingering drew attention. Sergeant Major Torres was waiting in room 214 when she arrived for the 8 o'clock assessment. Miguel, his 8-year-old son, sat on the hospital bed in Spider-Man pajamas that hung loose on his thin frame. The boy had been blind since birth, congenital optic nerve hyperplasia, the charts said. Untreatable. Irreversible. The kind of diagnosis that crushed families and spawned a month-long carousel of specialist consultations, each doctor arriving with less hope than the last. The sergeant major was in dress blues, which meant he'd come straight from base or hadn't slept since the last consultation. His eyes had the quality of a man who'd learned to make impossible decisions and live with them. Captain Bennett, he said, using the rank without thinking. Laura's hand stilled for exactly 1 second. Just one. Then she adjusted Miguel's pillow with the same unhurried motion she'd been using. "Good morning, Sergeant Major," she said quietly. "How's Miguel feeling today?" "Tired," Miguel answered before his father could. "Why do all the doctors ask the same questions?" Laura smiled at him, a real smile that reached her eyes. "Because we're all hoping the answers will change." "How's your headache?" Gone since yesterday. And the light sensitivity? Still there. Hurts in the morning. She made a note, not in the chart, in her head, and moved to the light test that Dr. Mercer would perform in approximately 4 minutes. The sergeant major watched her with an intensity that suggested he was trying to solve her equation. His son was blind. The doctors had no answers. But something about the way this nurse moved through the room made him feel less terrified, and he couldn't articulate why. The light sensation test was necessary, pointless, and brutal in the way that medical procedures were when performed on children. A penlight, a darkened room, the 8-year-old's face twisted in discomfort as Laura positioned the beam at the precise angle that would elicit a response without causing pain. There was a response, a slight contraction of the pupil, barely perceptible. She noted it. The sergeant major saw her note it. He'd been in the Marines long enough to recognize when someone was gathering intelligence, even medical intelligence, and filing it away for later use. The doors to the pediatric ward opened at 8:04 a.m. Dr. Mercer arrived the way he always did, white coat pressed to knife edges, stethoscope draped across his shoulders like a credential he needed everyone to see, smile sharp as surgical steel. He was 47 years old, had gone to Yale for undergrad and Johns Hopkins for medical school, and had spent the last 12 years climbing the hospital hierarchy with the methodical precision of someone who understood that power was a ladder and every rung had a name written on it. He'd never had to carry a patient through mortar fire. He'd never had to choose between amputating a limb and watching someone bleed out. His hands had never held a life together while the world exploded around him. He saw Laura adjusting the light test results on Miguel's chart and something in his chest tightened. "Morning rounds," he announced, though no one had asked. He didn't shake the sergeant major's hand. He didn't acknowledge Miguel. He addressed Laura as if she were a medical student who'd wandered onto the ward by accident. "Let's review the neuro status. Please present the findings." She'd expected this. The dismissal. The subtle repositioning of authority. Laura had been invisible in enough hierarchies to recognize the moment someone decided you were a threat. She'd done it to herself in Kandahar, made herself forgettable enough that nobody asked her rank, nobody questioned her presence in command meetings, nobody realized that the quiet woman in the corner was actually the one making decisions. That kind of invisibility was useful. It kept you alive. It also, apparently, infuriated men like Dr. Mercer. "Pupillary light reflex present bilaterally," Laura said, keeping her voice level, keeping her eyes on the chart instead of on him. "Mild photophobia, consistent with previous findings. No change from last week's assessment." Mild? Mercer's voice had an edge now, the kind of edge that made the other nurses on the ward suddenly very interested in their monitor screens. "Did you perform a complete neuro assessment or just the basics?" Sergeant Major Torres shifted on the chair. His hand moved to his son's shoulder in the automatic gesture of a parent sensing conflict. "Complete assessment," Laura said. She turned the chart toward him, showing her neat documentation. 23 years of nursing. Tens of thousands of charts. Every single one documented with military precision. Cranial nerves 2 through 12 intact. No sensory deficits noted. Reflexes appropriate for age. And the cognitive evaluation. Performed by Dr. Caldwell yesterday. Results are in the file. She hadn't flinched. Hadn't stepped backward. Hadn't offered an apology or an explanation for not exceeding her scope of practice. She'd simply stated facts, documented her work, and presented it without the defensive tone that came from people who were actually unsure. Mercer stared at her for exactly 3 seconds, and in those 3 seconds, something hardened in his expression, the moment a man decides someone needs to be cut down to size. "Well, let's hope your clinical observations are as sound as your documentation suggests," he said, turning to Miguel. "Tell me, young man, when was the last time you could see anything at all?" The boy's answer was honest. Never. He'd never seen. But as Mercer asked follow-up questions, each one more condescending than the last, as if Miguel's blindness somehow affected his comprehension, Laura watched the sergeant major's jaw clench. She saw the moment a father realized his son was being addressed like a medical anomaly rather than a person. She saw the moment he started taking mental notes. In room for 12, Marcus stirred when she checked his vitals an hour later. His eyes opened slowly, morphine-heavy, and for a moment, just a moment, something flickered in his gaze. Recognition. Memory. A face he'd seen before, caked in dust and blood, moving with the efficiency of someone who'd learned that hesitation meant death. Then the moment passed and he closed his eyes again, his morphine-addled brain unable to hold on to the ghost of a memory. Laura adjusted his blanket and moved on. What she didn't know was that the moment had lasted long enough. What she didn't know was that the other nurses on the ward had started watching her in a different way after Mercer's rounds, some with pity, some with the kind of distance that came from not wanting to be associated with someone a doctor had clearly targeted. What she didn't know was that in exactly 72 hours, everything would change in a way that would make his social campaign feel like a rehearsal for something far worse. But that wasn't the worst part. The worst part was that Sergeant Major Torres had seen the entire exchange, had watched a man with credentials and authority speak to a woman with competence like she was an obstacle to be removed, and had filed it all away with the kind of precision that came from running a combat unit. The worst part was that he'd already decided, in that moment, that if anyone was going to understand his blind son's condition, truly understand it, it wasn't going to be the doctor with the sharp smile and the inflated sense of his own importance. It was the quiet nurse with the scars she didn't bother hiding and the hands that never shook. She didn't know she'd made her first ally. Morning rounds at Seattle General in Raleigh always moved in formation, like a unit bearing down on an objective. Dr. Mercer led the way, white coat starched to knife edges, flanked by medical students who carried tablets and anxiety in equal measure. Laura followed 3 steps back, where the hierarchy demanded she stay, Miguel Torres's chart open in her hands. The boy lay in bed 412, his sightless eyes pointed toward the ceiling, his small frame swallowed by hospital blankets that smelled of industrial bleach and something underneath, fear. Sergeant Major Torres stood beside his son's bed, still in yesterday's clothes, still wearing the expression of a man who had no control over the one thing that mattered. Pupil response, Mercer said, flipping pages without reading them. Stable. Vital stable. The boy's doing fine. He turned to Laura, his eyes catching the fluorescent light like a predator's. Nurse Bennett, perhaps you can explain your documentation from 2 nights ago. You wrote, he paused, letting the silence stretch like a trap spring, concerns about increased intracranial pressure. When his vitals are stable. Laura's jaw tightened. Invisible. That's what she needed to be. His pupil response changed in the left eye. The reactivity slowed by approximately 1 full second. He also reported his left eye. Mercer's laugh cut through the hallway like a scalpel. Surgical. Precise. Devastating. He's been blind since birth. Left eye, right eye, what's the functional difference? One medical student actually snickered. The other looked at her shoes. Perhaps you need a refresher on basic pediatric neurology before you document concerns that frankly border on fabrication. The words hung in the air like shrapnel. Laura felt them land. She'd taken worse. Rounds in Kandahar under fire felt gentler than this, at least then the threat was honest. But she did not flinch. She did not redden. She took one measured breath, let her eyes find Mercer's across the small space between them, and when the single tear escaped, unbidden, salt and involuntary, she wiped it away without breaking contact. I've seen braver men than you bleed out calling for someone who cared. The room went dead silent. Mercer's smile froze. Became something archaeological, a fossil of arrogance just before extinction. He turned back to Miguel's chart with jerky movements, his voice dropping to a measured monotone about discharge planning while everyone pretended the moment had not happened. The medical student stared at their shoes or the ceiling or anywhere but at her face. Sergeant Major Torres met her eyes for exactly 2 seconds, enough time for her to see he understood something had just shifted, even if he didn't know what, before she turned and walked back through the unit doors. 3 days passed. Laura worked her shifts in the accepted rhythm of Seattle General, Med Pass at 0600, afternoon assessments at 1,400, nights spent charting in the small break room tucked behind the supply closets where most of the staff gathered. She'd always been quiet. The transition to isolation felt like removing a uniform and realizing you'd forgotten how to breathe without the weight of it. The break room smelled like old coffee and microwaved something from the weekend nobody had claimed. Laura sat with her hands wrapped around a mug, the tag from a chamomile tea steaming upward, and the conversation stopped like someone had hit a mute button. Two nurses she'd worked alongside for 8 months suddenly remembered urgent tasks in different rooms. A resident who'd asked her advice on a patient presentation yesterday now studied his phone with the intensity of someone defusing a bomb. The silence felt thick enough to intubate. She understood what had happened. Mercer had been conducting his consultations in that corner office on the 3rd floor, the one with the door that stayed closed and the windows that didn't let you see anything real. He was poisoning the well one staff member at a time, dropping concerns about her limited training, her boundary issues, her apparent inability to understand scope of practice. Probably mentioned the public humiliation from rounds. Probably added details that made it sound worse than it was. Probably told them she was unreliable, that asking her for help was a liability, that they shouldn't be seen too closely associated with someone who was clearly on the wrong side of the hospital hierarchy. By week's end, Laura ate lunch in her car. She sat in the parking lot behind the north entrance where the dumpsters masked the smell of asphalt and dying summer heat, her sandwich untouched on the dashboard, watching the ER bay doors cycle open and closed. People who could afford to take up space moved freely. People who threatened the order were slowly erased from the room. She knew this pattern. She'd seen it before in different uniforms, different buildings. Power protected itself first. Then came the final escalation. Laura arrived at her locker on a Monday morning to find a printed notice posted on the unit board, the kind of public humiliation that had a specific gravity, specific destructive potential. The paper was laminated, official, embossed with Seattle General letterhead. It read like an indictment. Disciplinary notice, Bennett, RN, overstepping clinical boundaries, questioning physician orders, creating confusion in care team. She stood in front of it for 18 seconds. Didn't move. Didn't react. Just read each word and let it settle into the specific file in her brain marked evidence. Mercer was standing near the medication station, ostensibly reviewing something on the computer, but his eyes tracked her reflection in the monitor. Watching. Waiting for the flinch that would never come. Sergeant Major Torres arrived for afternoon visiting hours and saw the notice before he reached his son's room. She watched his face move through confusion, then recognition, then something like helplessness. He stood there in his civilian clothes, jeans and a polo shirt that couldn't hide the way he carried himself, like someone trained to bear weight, and the expression of a man watching the only person who seemed to truly care about his son get systematically dismantled. He pulled her aside in the hallway near the stairwell. His voice was quiet, but it carried the kind of authority that came from having given orders to people with weapons. "Why won't anyone listen about my son?" The crack in his voice was small but audible. Like a line fracture in a load-bearing wall. "You're the one who sees him. Everyone else just looks at the chart." Laura held his gaze. There are things happening that need attention. Things his doctors might be missing. She chose her words with surgical precision. "But I'm being constrained right now. By Mercer. By the system that protects Mercer." The sergeant major's jaw worked. She could see him calculating, measuring, the way combat veterans do when they're trying to solve a problem that used to have military solutions. He looked toward the hallway where Mercer moved between patient rooms, untouchable, protected by credentials and hierarchy and a system that had been designed by people like him to keep them safe. That night, Laura sat at her kitchen table while her daughter slept upstairs. The apartment was dark except for the phone screen in her hands. She pulled up the encrypted message thread from her handler, the one that came through a civilian email address about overtime scheduling and had nothing to do with scheduling at all. The briefing was clear: maintain cover. The sergeant major's unit had been flagged in intelligence reports suggesting a breach. Someone was targeting returning operators, accessing their families as leverage. That's why she was here. Not for Miguel. For the unit breach. For the classified operation that required her to pretend to be a nurse while actually being something else entirely. But Miguel's condition was deteriorating. His pupil responses were slowing. His headaches were worsening. The neurological deficits were subtle enough that a standard exam might miss them in a blind child, but they were there. Laura had seen enough head trauma in combat conditions to recognize the pattern of increasing intracranial pressure, and Dr. Mercer had scheduled the next specialist evaluation for 2 weeks out. 2 weeks was probably too long. She typed, "Patient deterioration possible. Physician oversight limiting intervention. Request guidance." The response came back in 4 minutes. Maintain cover. Patient welfare secondary to mission parameters. Do not escalate. Her daughter appeared in the kitchen doorway then, still in pajamas, hair dark and sleep-messed. "Mommy, why aren't you at work?" Laura closed the phone. The question was simple. The answer wasn't. Because the system protects people like Mercer. Because I made a choice between 2 different kinds of duty. Because sometimes the bravest warriors carry stethoscopes, not guns. I had something come up, Laura said. She pulled her daughter into her lap. "But I'm here now." The child pressed her face against Laura's shoulder, the way kids do when they trust you to hold them through anything. Laura felt the weight of it, the actual physical weight of someone depending on her. It was heavier than body armor. Heavier than weapons. Heavier than mission parameters written by people who'd never met Miguel Torres or understood that there were different kinds of breaking points. By morning, something would have to give. The system couldn't hold much longer. Friday morning arrived without warning, the kind of quiet that precedes everything falling apart. Miguel Torres hadn't eaten since Thursday dinner. His father called at 7:14 a.m., voice tight and controlled in the way of men trained to stay calm under fire. "He's complaining about his head. Says the light hurts his eyes. But he can't see the light, so how would he know?" Sergeant Major Torres spoke in fragments, the rhythm of someone used to giving situation reports, not asking for help. Laura was charting at the nurse's station when the call came through to the unit. She listened to the covering physician, Dr. Hastings, nod along to information he wasn't processing. Hastings was a hospitalist, competent enough with pneumonia and UTIs, utterly lost in pediatric neurology. He deferred to Mercer's existing assessments without conducting his own evaluation, without examining Miguel, without reviewing the progression Laura had documented with meticulous detail over the past 72 hours. "Dr. Mercer's plan is solid," Hastings said, scrolling through the chart without lifting his eyes. "Viral syndrome. Rest, fluids, antiemetics. Let's not chase shadows." Laura felt the weight of it settle into her chest like a sandbag. She'd seen this pattern in Kandahar, young soldiers convinced their headaches were dehydration, their fatigue just exhaustion from the heat, their deteriorating mental status a sign of homesickness rather than infection. She'd held 2 of them as they died because the chain of command moved too slowly, because protocols existed to slow down, not to save lives. "Miguel's pupils are reactive but sluggish," she said quietly. "His baseline hearing is acute, compensatory, and he's not responding to auditory stimuli the way he was yesterday." Hastings's fingers froze on the keyboard. For 3 seconds, he actually looked at her. Then he blinked and returned to his screen. Anti-nausea medication. Quiet room. Parents can provide emotional support. He closed the chart. Laura watched him walk away, her jaw clenching tight enough to crack teeth. She had 8 hours before her shift ended. Miguel had maybe less than that. The call from Sergeant Major Torres came at 2:16 p.m. Miguel was lethargic now, not responsive to his father's voice, not interested in the audiobook his mother played beside his bed. "His breathing sounds different," Torres said. Not a question. An observation from a man who'd assessed casualties in the dark with nothing but instinct and training. Laura stood in the medication room, door closed, listening to a combat veteran describe his child's decline through the barrier of a phone line. She made a decision that would cost her everything. "I'm calling someone," she said. "Not through normal channels. Someone who will actually listen." The line crackled. "You'd risk your position for my son?" "Already have," Laura answered. She disconnected and scrolled through a contact list she was supposed to have deleted 3 years ago. Dr. James Mitchell, Navy Medical Corps, trauma surgeon, Kandahar, July 2019. Field hospital, IED shrapnel through his femoral artery, exsanguinating, Laura's hand steady as surgical steel as she applied direct pressure and talked him through the shock while helicopters couldn't reach them for another 37 minutes. He'd survived. He owed her his life. He answered on the second ring. "Mitchell." One word, military precision. "It's Bennett. I need you to review a chart. Pediatric case, neurological deterioration. Normal hospital chain of command is actively preventing appropriate evaluation." She transmitted the file in a secure format that would leave no trace on the hospital network. 30 minutes. "That's all I'm asking." The silence lasted exactly 4 seconds. "Then, sending you my assessment in 20. He disconnected. Laura returned to the unit and entered Miguel's room, where Sergeant Major Torres sat with his son's hand clasped between both of his, reading aloud from a Marine Corps history book as if sound alone could hold his child tethered to awareness. Laura checked Miguel's vital signs without speaking. BP stable, heart rate elevated, O2 sat normal, the invisible signs of something building behind those blank unseeing eyes. She documented everything. Every observation. Every subtle change. Every deviation from baseline. The chart notes were clinical, precise, and irrefutable. A blood trail in ink. Mitchell's response came through encrypted text, classic epidural bleed presentation. Imaging confirms slow accumulation, probably from minor head trauma days ago, something this child couldn't report due to baseline condition. This kid needs a neurosurgeon in the next 6 hours or you're looking at herniation and organ failure. Get him imaging immediately. I'll pull strings with UMMC if needed. This should have been caught 48 hours ago. Laura's chest tightened. Not a medical emergency yet. Worse, a time bomb with an audible tick. She found Mercer in the physician's lounge at 4:33 p.m., feet propped on a coffee table, reading a golf magazine. The stale coffee smell hung around him like aftershave. "Miguel Torres is showing classic signs of epidural hematoma," she said. No preamble. No request. Sluggish pupils, lethargy, behavioral changes. He needs imaging. Now. Mercer didn't look up from his magazine. "You're not a physician. You're not a neurologist. You're a nurse pushing a narrative because that's what nurses do, you manufacture crises to feel important." He turned a page with deliberate slowness. "I've already assessed this patient. Viral syndrome. You're causing unnecessary alarm in the family." Laura's hands formed fists at her sides. The trembling wasn't fear. It was restraint, the kind that comes from having held weapons and knowing how to use them, choosing instead to use words. "Then order an MRI. Let imaging confirm your assessment." "No." He finally looked at her, his expression like a smile without any warmth behind it. "Stop trying to manufacture a crisis to make yourself look important. It's beneath you. Actually, no, it's exactly like you." The words landed the way they were meant to. But Laura's face remained neutral. Her breathing steady. She turned and walked out of the lounge. At 5:17 p.m., she filed a request for imaging through the formal system, documenting her clinical rationale in language so precise and undeniable that any reasonable physician would have approved it. Mercer's counterorder appeared in the chart 11 minutes later, request denied. Monitoring for clinical decompensation is appropriate first-line management. Further testing would constitute unnecessary radiation exposure. He'd signed it electronically, his timestamp machine precise, his authority absolute. Laura sat at the nurse's station for the next 3 hours, charting, watching the clock, listening to Sergeant Major Torres's voice come and go from room 412 as he called for updates that nobody could provide. At 8:42 p.m., Miguel vomited for the first time. Projectile. Bilious. The sound of it, the retching that came from deep in his chest, carried through the hallway like a siren. Laura was at his bedside in 8 seconds. Torres's eyes met hers over his son's bed, and something in his expression shifted, recognition, finally, that the threat was real. "Call Mercer," Laura said quietly. "Tell him Miguel's vomiting. Tell him you want imaging. Tell him you want it now." She turned to the covering physician station and logged the event: vomiting, projectile onset, at 20:42 hours, patient responsive but lethargic, Mercer notified. The documentation felt like a legal brief. Proof. Evidence. A paper trail leading nowhere except to the inevitable. Mercer arrived at 9:15 p.m. He looked at Miguel for 90 seconds, took his vitals himself, BP climbing now, 112/68, heart rate 118, and then looked at Laura with something that might have been recognition in his eyes. "Antiemetics," he said. "Continue monitoring. The vomiting is likely part of the viral presentation." He turned to leave. Sergeant Major Torres stood from the chair, and for an instant, something ancient moved through the room, the presence of a man who'd seen actual combat, whose hands had held weapons, whose voice could command 214 Marines. "My son needs imaging, Doctor." "I'm not asking." The request hung in the air like a bayonet. Mercer's jaw tightened. He left without responding. At 11:13 p.m., the hospital board called an emergency meeting. Laura received the notification via email from the chief medical officer's office. She was being suspended pending investigation into insubordination, patient endangerment, and unauthorized clinical consultation outside the hospital system. 6 separate incident reports had been filed against her in a 4-hour window. Mercer had itemized every interaction, every clinical suggestion she'd made, every time she'd questioned his assessment. He'd rewritten her previous chart notes, going back through days of documentation and altering the language to make her accurate observations sound paranoid, scattered, clinically unsound. Patient appears overly focused on neurological symptoms she'd written originally, documenting Miguel's presentation. Mercer's revision read, nurse reports projected anxiety regarding patient outcome, may indicate excessive personal investment in case. Her words transformed into evidence of her own instability. She called Sergeant Major Torres at 12:34 a.m. from her car in the parking lot. The rain hammered the windshield like applause or accusation. "I have to step back from Miguel's care," she said. Her voice didn't crack. Her hands didn't tremble. "The hospital is suspending my privileges pending an investigation. I'm no longer cleared to treat him." The silence on the line lasted 14 seconds. She counted them. "You did everything right," Torres said finally. "I saw it. I know what you did." But knowing wasn't saving his son. Understanding wasn't overriding the institutional machinery that protected doctors who followed protocol over doctors who questioned it. "I'm sorry," Laura said. "I'll find him another advocate." "Someone inside the system who can." "You were the advocate," Torres interrupted. "You were the only one." She disconnected and stared at the folded flag in her passenger seat, the one from her locker, the one supposedly from a brother, the one actually from a field hospital in Kandahar where she'd wrapped a teammate's remains with her own hands while shell casings clinked against the floor. Her handler had already sent an encrypted message: maintain cover. Do not engage. Mission priority unchanged. Laura deleted it without responding. Some missions were more important than operational security. Some promises transcended clearance levels. At 6:44 a.m. on Saturday morning, as Miguel Torres's intracranial pressure climbed in increments that only machines could measure, as his pupils began to dilate in the asymmetric way that meant herniation was coming, as his father sat beside him whispering prayers in Spanish and English to a God who'd already heard enough petitions from fighting men, Dr. James Mitchell walked into Seattle General with Navy credentials and the kind of authority that comes from saving lives on the actual edge of death. He reviewed Miguel's chart in the neurosurgery consult room. He looked at the imaging request that had been denied. He looked at the documentation of clinical decline. He looked at the wall between a system designed to protect its own and a child who didn't have time for protocol. And then he moved like apex predators move, fluid, precise, unstoppable, straight to the chief medical officer's office to explain what epidural hematoma looked like in its early stages and why someone should have seen it 24 hours ago. Tuesday night at 11:02 p.m., Laura's phone lit up in the dark of her apartment where she sat at the kitchen table in scrubs, still unable to change, unable to move. The hospital alert system pinged twice, the sound she wasn't supposed to be monitoring anymore, the one she checked obsessively anyway because old habits from classified work die hard. Miguel Torres. Code blue imminent. Acute neurological deterioration. The words didn't require her to think. Her hands were already reaching for her keys. She wasn't supposed to be there. The suspension letter was 3 days old, her termination pending investigation. The hospital had made it clear, stay away or face criminal charges. She drove anyway, 63 miles per hour through empty streets, her hands locked at 10 and 2 like she was piloting a helicopter instead of a Subaru. The Marines didn't train you to follow protocol when a child was dying. They trained you to move. The ER entrance doors hissed open at 12:04 a.m. No one stopped her. Her badge still worked, they hadn't revoked it yet, probably hadn't thought of it yet. The ICU was 3 floors up. She took the stairs 2 at a time, muscle memory overriding every warning bell in her mind. The doors to pediatric neuro were locked after midnight. She badged in. The hallway smelled like antiseptic and the particular chemical stench of fear sweat from staff who didn't know what they were looking at. Miguel's room had the electric hum of 6 different monitors working in dissonance. The covering resident, his name tag read Chen, 26 if that, was frozen at the bedside, hands hovering over nothing, watching the 8-year-old seize like he was witnessing something no textbook had prepared him for. Miguel's head thrashed against the pillow. His spine arched. His eyes had rolled back until only the white showed. The EKG screamed. The intracranial pressure monitor on the wall climbed like a countdown to something terrible. How long? Laura's voice came out low, carrying the command authority that made the resident's hands drop to his sides. 2 minutes. Maybe 3. The neurosurgeon is 20 minutes out and Dr. Mercer isn't. Get me a drill and local anesthetic. Now. The resident's mouth opened. Closed. I can't authorize. He'll herniate before the neurosurgeon arrives. You want to explain that to his father, or do you want to move? The resident moved. He was gone before his brain caught up with her voice, and that was the thing about command authority, it didn't require justification. It required the certainty of someone who had already seen the worst thing possible and was still breathing. Laura pulled on sterile gloves one-handed while her eyes tracked the monitor. O2 sat 91 and dropping. Heart rate 168. Intracranial pressure 62 and climbing. 65. 70. The epidural hematoma that Mercer had missed, that he deliberately ignored, was bleeding faster than physics should allow. Miguel's left pupil was dilating, a tiny circle widening like a door opening onto catastrophe. If she didn't release the pressure in the next 90 seconds, his brain would squeeze through his foramen magnum and he would stop being Miguel Torres. He would become a body on a pediatric stretcher. The resident returned with the drill and a vial of 1% lidocaine. Laura injected the local anesthetic into the temporal region without hesitation, muscle memory from a compound in Kandahar where there had been no anesthesiologist and no time. The smell hit her, the particular metallic stench of bodily fear response, copper and adrenaline mixing with the chemical green of the surgical field. She'd smelled it 1,000 times in a life she wasn't supposed to remember. The drill was smaller than the one she'd used in the field, designed for precision rather than urgency, but urgency was all she had. She positioned it at the temporal bone, anterior to the tragus, pressed the trigger. The high-pitched whine filled the room like a sound from another life, another war, another person wearing her face. The bone resisted. Then gave. then opened. Dark blood poured from the hole. Not the pale arterial spray that would mean she was too late, but the darker venous ooze that meant the hematoma was just starting to decompress. She watched the pressure gauge. 72. 70. 68. Miguel's seizure stopped as if someone had flipped a switch. His body went slack. His eyes remained open but present, his breathing still rough but no longer the panic gasping of a child whose brain was fighting against a skull too small to contain it. 62. 58. Stable. The resident was staring at her like he'd just watched someone open a door to somewhere impossible and step through it whole. "How did you?" he started. "Pressure bandage. Triple antibiotic. Watch him every 4 minutes. When the neurosurgeon arrives, you tell him burr hole was performed at 12:07 a.m. to prevent herniation. You document my presence. You document exactly what you saw." Laura pulled off her gloves. "And you don't apologize for saving this child's life." Sergeant Major Torres was in the doorway. She hadn't heard him arrive, hadn't heard the door open, had been so deep in that other life that the real world had fallen away. But he was there now, his massive frame filling the space like a monument, his mouth open, his blind son stable on the bed behind her, his face cycling through expressions that had no names. He looked at Laura. At Miguel. At the blood on the sterile field. At her hands. He didn't say anything. Sometimes silence was the only language big enough to contain what had happened. By 6:51 a.m., Miguel was extubated and breathing on his own, his intracranial pressure stable, his neurological exam intact. By 8:15 a.m., Dr. Mercer arrived at the hospital to discover that the emergency burr hole procedure had been performed while he was unreachable, that his patient had survived an intervention that, according to hospital policy, he had no authority to perform. By 8:36 a.m., he had filed 6 separate incident reports. By 9:48 a.m., he had filed for more. The documents were brutal in their precision. Unlicensed practice of medicine. Performing procedures beyond scope of nursing credential. Operating under suspended status despite explicit administrative directive. Reckless endangerment of pediatric patient. Each one was constructed carefully, expertly, weaponized by someone who understood that institutional murder happened in triplicate forms and required only the right paperwork. The hospital board called an emergency meeting at noon. Laura wasn't invited to speak. By 2:38 p.m., Sergeant Major Torres received a formal letter explaining that Laura Bennett had been terminated immediately pending investigation into criminal charges related to unlicensed medical practice. The letter was 9 pages. It referenced court cases. It cited statute. It was a document designed to ensure that if her name ever came up again, it would be associated with recklessness, with protocol violation, with a kind of clinical arrogance that destroyed careers and ended lives. Laura left a note on Sergeant Major Torres's chair in the ICU waiting room. Just one sentence: "I had to step back from Miguel's care. I'm sorry." She didn't wait to see his face read it. She didn't have the composure for that. At 2:14 p.m. on Wednesday, her 7-year-old daughter came home from school to find her mother at the kitchen table in street clothes, still in yesterday's scrubs underneath, shoulders moving in a way that made the child's voice go small and confused. "Mommy, why aren't you at work?" Laura pulled her daughter close and couldn't find the language to explain that saving a life sometimes cost everything. That the system protected its own before it protected the truth. That sometimes being the best meant becoming invisible. She held her daughter and let her daughter hold her, and somewhere in that Seattle afternoon, a child's questions about why her mother was breaking became the only sound in a house that used to echo with hope. The letter in Laura's locker, the folded flag from a Marine who had died in her arms in Kandahar, sewn into the pocket of a uniform she wasn't supposed to keep, remained there, waiting. It had survived 7 years of deployments and 1 week of professional destruction. It would survive this too. But she didn't know that yet. In this moment, she only knew that she had broken protocol to save a child, and the system had punished her for it, and somewhere in the hospital where she could no longer work, a father was learning that the person who had saved his son's life had just lost her own. The trauma bay doors burst open at 11:36 p.m. on a Tuesday, and the man on the stretcher had eyes the color of storm clouds over the Hindu Kush. Shrapnel scars mapped his neck like a roadmap of survival. His accent was thick, Pashto syllables rolling off his tongue as nurses wheeled him past the waiting area where Sergeant Major Torres stood vigil for his son. "Angel of Kandahar," the man whispered, his voice carrying across the tile floor like a radio frequency suddenly tuned to a station everyone had forgotten existed. Loud enough for the Marine sitting beside Torres to hear. Loud enough for the charge nurse to pause mid-stride. Loud enough for the entire surgical suite to understand that something had just shifted in the architecture of this hospital. Laura moved toward the stretcher without hesitation, her hands already reaching for vitals, her voice dropping into the register that belonged only to field medicine and crisis, low, precise, the cadence of someone who had done this in compounds where the walls were mud and the lighting came from hurricane lamps. The man's hand found hers. His grip was iron. "You saved my brother in Kandahar. 2011, Sanjin Valley. I was there. I saw your face through the dust." The room went so quiet you could hear the ventilator in the next bay wheeze its mechanical rhythm. Sergeant Major Torres stood. He moved with the careful deliberation of a man whose entire body had learned to respond to invisible orders, and he pulled his phone from his pocket with trembling hands, not from fear, but from recognition. His daughter had told him stories. His wife had asked why he woke up some nights saying a woman's name. His son Miguel had drawn pictures of an angel with kind eyes. Torres's fingers moved across the screen. The brightness of the display illuminated his face as he scrolled through a military database he shouldn't have access to but did, the kind of clearance that never expires, that opens doors in the Pentagon basement even after you take off the uniform. One of the Marines beside him leaned closer. Then another. The screen grew brighter as 3 pairs of eyes read what had been classified until approximately 17 seconds ago. "Captain Laura Bennett," Torres said aloud, his voice steady but hollow, like someone reading a name off a memorial wall. "For extraordinary heroism in combat operations. Silver Star." He looked up. His eyes met Laura's across the trauma bay. "Bronze Star with Valor." The surgeon walking past stopped. The nurses froze mid-task. The resident pushing the crash cart slowed like someone had adjusted the frame rate of reality itself. Torres kept reading, his thumb moving down the glowing screen, and with each line the temperature in the room seemed to drop another degree. 2 purple hearts. His voice cracked on the word 2. Combat nurse designation. 14 years active service. 3 deployments. Kandahar, 2010 to 2012. Laura was still moving, still working the trauma patient's vitals, still functioning, but something had changed in her shoulders. The tension there had shifted from the controlled alertness of field medicine to something else entirely. The mask that she had worn for 8 months in this hospital, the modest demeanor, the deference, the careful invisibility, had developed a hairline fracture that was spreading across its surface like ice in spring thaw. The hospital lobby doors opened at 12:03 a.m., and a 2-star general in dress blues walked through with the kind of presence that made the air pressure change. General Wade. His salute wasn't parade ground ceremonial, it was field-stripped and deliberate, his fist to his chest in the Marine fashion, his eyes locked on Laura with the expression of someone who had spent the last hour confirming that a ghost was real. Behind him came an aide carrying a security deposit box. The aide opened it. Inside were decorations in their original presentation cases. Medals that had never been worn publicly. Citations that had been filed under classification levels that required Pentagon approval to declassify. The general lifted each one like he was handling relics. "Captain Bennett," he said, and the way he said it made it clear that every person in this hospital was standing in the presence of something they had fundamentally misunderstood. "One of the finest combat nurses the Marine Corps ever produced. Your service record speaks for itself. Your valor speaks louder." Dr. Mercer pushed through the crowd that was forming, a crowd that included 2 security officers, 3 nurses, a resident, and the hospital administrator who had just been paged and was still buttoning his shirt as he walked. Mercer's face was the color of hospital walls. His hands were trembling in a way that had nothing to do with caffeine. "This is a stolen valor stunt," he said, his voice cracking like he was breaking from the inside. "This is fraud. I don't know what kind of." "Stand down," the general said. Not loud. Not aggressive. Just the kind of quiet command that had been obeyed across 2 continents by men with weapons in their hands. Mercer went silent the way a dog goes silent when the tone changes. The general turned back to Laura, and his eyes were wet. "Your mission was compromised. We pulled your protective detail 4 hours ago. You've been cleared for full recognition." What happened next didn't just silence the room. It ended careers. 36 hours later, phone footage circulated through the medical community, video from someone's body camera, footage that showed Mercer's earlier tirade about basic pediatric neurology, his dismissive wave when Laura had raised concerns about Miguel's condition, his smirk when she was reading the disciplinary notice. The video was everywhere by evening. Reddit threads. TikTok. Medical forums where physicians watched their colleagues systematically destroy someone he didn't understand and didn't respect. The comments accumulated like casualties. "He tried to destroy a Silver Star recipient for doing her job. She saved a child's life and he tried to have her arrested. This is what happens when competence threatens ego." By morning, a second video had surfaced. Older footage. Security camera documentation of Mercer's hallway tirade, his voice clearly audible. "You think your little heroics impress me? You're a nurse. Act like one. A nurse." The words were still echoing through chat rooms and comment sections when Laura's actual personnel file went live, the real one, the declassified one that had been locked behind Marine Corps security clearances. Captain Laura Bennett. Combat nurse. Military intelligence liaison. 3 combat deployments. Kandahar, 2010 to 2012. Fallujah, 2007 to 2008. Anbar Province observation. 14 years. Her credentials as a registered nurse were impeccable because they had to be real. Deep cover placement required actual competence. Actual skill. Actual years of saved lives. Friday morning, Dr. Mercer received an email. The sender line read, "Dr. Raymond Keller, retired Army surgeon." His mentor. The man whose photograph sat on Mercer's desk in a mahogany frame, the man who had written his fellowship recommendation to Johns Hopkins, the man Mercer had named his daughter after. "I have seen the footage of your treatment of Captain Bennett. I am appalled. I am requesting the State Medical Board review your fitness to practice medicine. Do not contact me again." The hospital placed Mercer on administrative leave within 2 hours. By Sunday, his wife had asked him to sleep in the guest room because the death threats had started arriving at their home address, people who served with Laura, people whose lives she had held together in places where the dust was red and the screaming never stopped. By Monday, patients requested transfers from his service. A formal complaint was filed by the Marine Corps liaison documenting how Mercer's interference had delayed critical care. The hospital's legal team calculated liability and reached a conclusion. Mercer was offered the option to resign rather than be terminated for cause. He resigned on Tuesday. 6 months later, Dr. Mercer taught CPR compressions to bored community college students for $17 an hour. He demonstrated chest compressions on plastic mannequins whose eyes never judged, whose chests never remembered the weight of his negligence. No one in the classroom asked about his previous career. He was invisible now, but not the way Laura had been invisible, not with competence and choice, but with erasure and consequence. At Seattle General in Raleigh, Laura sat in the pediatric neuro ward on a Wednesday afternoon where the fluorescent lights hummed their monotonous frequency. Miguel Torres sat beside her, 7 weeks post-op from his permanent intracranial pressure shunt, his new retinal implant still learning to interpret light and shadow. The device was state-of-the-art, the kind of technology that had been accelerated through trials after the general's involvement became known. Miguel blinked slowly, staring at Laura's face as if trying to memorize something he had only known through sound and touch. "I can see light," he whispered. His small hand gripped hers with the strength of a child who understood, on some level too deep for words, that this woman had held him together when his body was breaking. My dad always said an angel saved him in Afghanistan. He said she had kind eyes and hands that didn't shake. The boy's eyes, seeing for the first time, filled with tears. I can see your eyes now. They are kind. They are exactly like he said. Sergeant Major Torres stood in the doorway in civilian clothes, his hand over his mouth. Laura held Miguel's small hand as shadows and shapes resolved into focus around them, his father's face, weathered and stunned, the window light falling across the room like benediction, the folded flag in its shadow box on the wall with Laura's citations beside it, a gift from the Torres family that had become a permanent fixture. Corporal Whitfield from across the hall stopped by, finally able to see the face that had looked down at him through smoke and blood in a compound where the walls were mud and the mercy came from hands that had been trained in 3 wars. "Thank you," he said simply. "I remember your voice. I didn't know it was you." Laura didn't flinch. She didn't look away. "You were bleeding out. What was I going to do, leave you there?" A dry laugh escaped Whitfield's chest, the sound of someone who had just realized the absurdity of thanking someone for doing the only possible thing. "I guess not." General Wade had arranged for Laura's transition to a veterans hospital role, a position that would let her use both sets of skills openly, nurse and intelligence officer, healer and guardian. As she left her final shift at Seattle General, the entire nursing staff lined the hallway in formation. They saluted, technically improper for civilians, but no one cared about protocol anymore. Laura walked through them with quiet dignity, the same composure she had carried through compounds and corridors, through humiliation and vindication, through the kind of silence that comes from people finally understanding what they were standing next to. In the parking lot, her daughter waited in the car, drawing pictures of nurses with capes and stethoscopes. Laura got in, took one measured breath, and smiled. Her phone buzzed with a message from Torres. "Miguel asked me today what an angel looked like. I told him to remember your face." The truth didn't just silence the room that night. It changed everything. If this story resonates with you, if you've ever been underestimated, if you know the quiet strength it takes to wait for recognition, subscribe for more stories about hidden heroes. Leave a comment telling us about a time someone surprised you with their true capability. And if you know a veteran working in healthcare, take a moment to say thank you. They're still saving lives. You just might not know it yet.